Hey everyone, Dr. Ackerman here with Active Chiropractic Care, and we're going to be going over the most important stretches that our patients need to know when it comes to their shoulders. So the shoulder is a ball and socket joint, and the ball needs to be moving freely within that socket. And then you have four muscles, which are known as the rotator cuff muscles, that wrap around the arm and keep the ball in the socket. Now, the most common injuries that occur from misalignments in the shoulder and trauma to the shoulder is what's called impingement. An impingement is a way of saying that the ball is out of alignment in the socket and it's jamming into certain pieces of the body as it moves up and down. So what we need to do is focus on stretching and balancing the muscles around the arm and shoulder and allowing that ball to float freely in the socket. And then the next video we'll talk about strengthening the muscles around it. So the first stretch we're going to show you is an upper trapezius stretch, and that's going to help pull the shoulder back and down while you lean away from your shoulder. So these muscles are very important in keeping the shoulder at a safe distance in the neck and upper middle back. So you're going to focus on that stretch for 15 to 20 seconds. And then the next stretch is your chest stretch. So the chest stretch, you're going to be focusing on the pec major muscles, which are going to be pulling the arm straight back and lunging forward. And you're going to hold this for 20 seconds. And then you're going to reach up at 45 degrees to stretch the pec minor. Now, pec minor is probably the #1 most responsible muscle for causing impingement in the shoulder. And this muscle is the #1 most important muscle for anyone to be focusing on if you have any type of shoulder pain or shoulder problems. So again, to stretch the pec minor, you're going to put your arm up at 45 degrees, you're going to step forward with your opposite leg, and you're going to lunge forwards to feel the stretch into your chest. Whenever you're stretching your chest, you want to make sure that you're not sacrificing the alignment of your neck, so keep your chin tucked back and in, and make sure that you're looking straight ahead. You're going to hold that stretch for 15 to 20 seconds as well. And whether or not you have a shoulder problem or not, or if you have pain in one shoulder versus the other, you always want to make sure that you're doing your stretches on both sides. So make sure that if you do it on the left, you're doing it on the right as well. Whether you have pain or not, you want to keep it even. Then we have the rotator cuff muscle stretches. So like we were talking about earlier, those are the four muscles, supraspinatus, infraspinatus, teres minor, and subscapularis, that all wrap around the glenohumeral joint to keep that ball in the socket. And this is a really important stretch for you to do. So you're going to take your arm, if you're stretching your left shoulder, and you're going to reach across your body, and you're going to pull and stretch the arm. And what you're going to feel is some stretching going on in the back of your shoulder. And those are some of your rotator cuff muscles. Then what you can do is you can lift up that elbow more towards your neck, and you're going to feel it stretch even lower down. So what you just did is you went from stretching the infraspinatus, which is one of the rotator cuff muscles, to the teres minor, which is another one of the rotator cuff muscles. So that's a really good rotator cuff stretch. Then if you want to stretch a supraspinatus muscle, which is more up here, you're going to take your arm and bring it behind your back, and then you're going to do something similar to the upper trapezius. You're going to pull the shoulder back and down, and you're going to look down towards your opposite foot. And you're going to feel some nice stretching going on behind your neck and also behind your shoulder blade on the top. And that's where your supraspinatus is located. So those are really important rotator cuff muscle stretches. And then lastly is a Brugger stretch, because we know that shoulder issues are due to impingement. And impingement is due most commonly to overactivity of the chest muscles, which pull the muscles forward, right? It internally rotates that shoulder, bringing that shoulder down and in, so that when you go to raise your arm, it gets jammed into your acromion process. So basically, you're hitting the ceiling, and that's what causes the impingement. So what we need to do is roll the shoulders back, releasing that chest muscle, creating more range of motion, more clearance for that arm, so that that ball does not get jammed into the socket. And how we do that is what's called a Brugger's. So a Brugger's is when you pull your shoulders back and down, you externally rotate, so you open up those palms, and you hold your shoulders back and down while you tuck the chin in at the same time. So you're going to hold this for a good 15 to 20 seconds, and what you want to focus on is squeezing the muscles in your back and your shoulder blades so that it becomes more of an active stretch. You're not just holding your arms out to your sides, you're pulling your shoulder blades back and down, and you're squeezing your shoulder blades together. So this is a Brugger's exercise. And then lastly, but most importantly, when you come out of the Brugger's, you want to let your arms rest by your sides, keeping your thumbs pointing straight ahead and your shoulders still back and down so that the ball is now in the socket, and that's going to prevent your shoulders from developing any future impingement or rotator cuff problems down the road. So hopefully these exercises and stretches help you, and we're going to go ahead and show you some other ways that you can release these muscles as well. Talking about stretches that you can do to help with the shoulder. So the shoulder, luckily, is one of the areas on the body that you can actually do a lot of the work yourself because you can reach it and you can work on it yourself. But what you're going to need is the help of some of these therapy tools. So this is a Theracane, and what we are going to be using it for is to release the supraspinatus muscles. We're going to show you how to release the pec minor muscles, and then we're also going to get into the infraspinatus as well as the rhomboids. So first, the pec minor, you're going to find that tender point right between where your chest and your shoulder meet, and you're going to dig this right in there, and that's where you're going to move the arm up and down like you're trying to wave someone down over here, and then you're going to press overhead up and down as well. So these two motions are really helpful in actively releasing the pec minor. And then don't forget to do your stretch in between. So once you release the muscle, you always want to stretch it. Then you have the supraspinatus. Supraspinatus, you always want to have your arm behind your back, which helps bring the supraspinatus to the surface. And then what you're going to do is you're going to find that point right between the spine of your scapula. So you're going to feel the bone right here on your shoulder blade. And you're going to go behind your trapezius muscle. So you have your trapezius muscle, and you have this bone right here, which is the spine of your scapula, and that's where you're going to place the Theracane right in between those two. That's your supraspinatus muscle. And you'll know you're on that muscle because usually it's pretty tender, and you can always find a trigger point or two in there, especially if you have any kind of shoulder impingement or shoulder issues. So that's where you're going to work on finding that muscle, and then once you find it, you can rotate the shoulder both clockwise and counterclockwise, or even just shrug it up and down, which is going to help you to mobilize that supraspinatus. Then you have the infraspinatus, which is the muscle right behind the shoulder over here, and that's something that you can work on with the therapy tool as well by reaching in here like so and hooking in to that infraspinatus muscle, and that's something that you can work on with your Theracane as well. So you can kind of see how I'm using the Theracane to pull in and out of that area, and it's a really good way to release that muscle. And then lastly is the rhomboids. The rhomboids are in the back, so they're hard to get to unless you have one of these tools. So what we're doing is we're going along the spine, between the spine and the shoulder blade, and that's where you have the rhomboids. And once you find a trigger point, you're going to pause right on that trigger point. Now I'm pulling forward, so I'm creating pressure into that trigger point, and I'm going to rotate my shoulder blade clockwise and counterclockwise, and that definitely lights up that trigger point that I have in my rhomboid. So this is a Theracane, really good tool to use to release the muscles of your rotator cuff in your shoulder, and that's a great way to help start to loosen up and balance out that glenohumeral joint. Okay, so next we have a lacrosse ball. So now, just like we use the Theracane, if you don't have a Theracane, you can use the lacrosse ball as well. So we're going to fly through this because it's the same areas, we're just using a different tool. So to take the lacrosse ball, you're going to place it right on top of that supraspinatus, and you're going to roll that lacrosse ball around. Once you find a trigger point, you're going to press down, and you're going to rotate the shoulder both clockwise and counterclockwise. Same thing with the chest. Place the lacrosse ball in between the shoulder and the chest. Find that trigger point in the pec minor, and then you're going to go over to a wall and lean into it, and you're going to again try to flag down that person over there by moving your arm up and down, and you're also going to do the same motion where you press overhead up and down. Then don't forget always to stretch the muscle after you released it. The lacrosse ball is a really good one to use for the infraspinatus. So again, you're going to cross the arm across your body. You're going to find that tender point right below your shoulder, and you're going to hold it for 10 to 15 seconds to release the trigger point, and then you can rotate and you can work out that lactic acid as well. And lastly, if you can balance the ball on the wall, then you can get into the rhomboids. So it gets a little tricky to use this on the wall. Right there is my trigger point, and that's definitely something you want to hold for 10 to 15 seconds, and then you're going to work it out and get that lactic acid out. So that's how you use the lacrosse ball. We have a fancy version of that called the Vertiball. Now what the Vertiball is, it's basically a stationary lacrosse ball. So you notice how I was kind of struggling on that last one to focus on keeping the ball on the wall while getting the right point and putting the right amount of pressure into the trigger point. So the nice thing about this Vertiball is that it's now stationary, so I can isolate that muscle and I can put just the right amount of pressure, and I can really work on that knot and releasing that knot specifically. You can also use it again for infraspinatus, working into that muscle and finding the trigger point in the infraspinatus. You can use it for pec minor, doing the same thing. You can even do a little bit more because it's stationary. And don't forget to wave down that plane or press overhead up and down, and then stretch the chest in between. The only thing you really can't use this for is the supraspinatus. I mean, I guess you could if you wanted to, but it gets a little tricky. I'd recommend using the Theracane for that one. And last, but certainly not least, one of my favorite tools is the PureWave massager. So this is another tool that we have here at our office. If you don't have this exact tool, you can use any handheld massager. They also make a lot of different self-massage tools nowadays that you can use yourself. But the nice thing about vibration therapy is it really helps to activate those deep muscle spindles within the muscle, which helps to give you more of a neurological response and loosen up those muscles even more. So that's why we like using the PureWave massager. So you can use it here for the chest. So while you're doing a stretch, you're going to get in there and work out the pec minor. You can do it for supraspinatus with that arm behind your back and really work out that supraspinatus. You can do it for infraspinatus and really get in there. So the vibration allows the muscles to lengthen and gives you more of a stretch without having to work as hard to get that stretch. And then you can also use it, of course, for the rhomboid as well. And once you find a trigger point, you just hold it on that trigger point for 10 to 15 seconds and let the massager do the work. So those are some of the most effective tools that you can use to release the shoulder, rotator cuff muscles, and the muscles that contribute to the most common issues that we see here in our office with the shoulder. So I hope that they help you. If you have any questions, feel free to contact the office. Leave us some messages. We'll definitely respond to you. And most importantly, remember to stay healthy and stay active.